Morning, everyone. Get your attention. Get started. Morning.
Morning.
I'm Zeke Smith. I work for the Waters Meat Foundation.
Good morning, Emily Cameron with the Downtown Spokane Partnership.
We're two of what is often referred to these days as the Five, which includes Alicia and Lance from TSI and from Greater Spokane Valley Chamber of Commerce, and then Lucretia Hill. It's not her, it's Letitia Hill with Avista is our fifth partner. We wanted to welcome you in this morning, say thank you for being here, for spending some time with us. This is the third day of 3 where we've been working on these issues with a whole bunch of folks. There are about 100 folks, many of you who were here over the last couple of days working on an asset assessment, and you're gonna hear a lot more about that. We wanted to point out the bathrooms in case you need them over the next couple hours, or out these doors through the next set of doors to your right. If you make it out into the main lobby, you've gone too far. And then there's a cafe that's behind those doors in the back that has coffee and water if we run out in the back, or if you want to try a different type of coffee or water than what's in the back. And anything else, Emily?
So first of all, thank you. Many faces. We have spent a lot of time together in the last 48 hours. So thank you for showing up for day 3. Today we have a good packed agenda for you. So we're not going to take much time here for introductions. Please, there is food and water in the back as well. We don't want to have to take that with us when we leave today. But want to just share, Rachel, who you all met in our last meeting, in the first task force meeting, is online, as well as we have a couple folks who could not be here with us today who will be listening online. But with that, I am going to go ahead and hand over the floor to Kate Chunkus, who most of you had a chance to meet in our first meeting, and kick us off and some introductions.
Good morning, and first thing, let's just go quick around the room because some people are here for the first time, and I know all of you don't know each other. So, Chud, if you could start.
Hey, good morning. Chud Wendell, Executive Director of the Hutton Settlement and Incoming Board Chief of the Greater Spokane Valley Chamber of Commerce.
Good morning. My name is Steve Leifman. I was a judge in Miami-Dade County, Florida for 30 years, and I always tell people I had 2 full-time jobs. One was being a judge, and the other was working on mental health issues, because sadly, the criminal justice system is the mental health system in America, and I only wanted 1 full-time job, so I retired from the bench. And it turns out this is 4 full-time jobs. I am thrilled to be in Spokane, and just could not be more impressed with the community and the will to make some change. So thank you all very much for the opportunity to be here.
And Judge Leifman started the Leifman Group at the beginning of this year, so I'm a partner. My name is Patty Tobias, and I'm thrilled to be here. I mentioned to a few of you that I was your neighbor as the state court administrator in Idaho for over 20 years, and then I had the privilege of being the project lead of a national judicial task force of chief justices, state court administrators, key judges across the nation, and we developed over 100 publications and resources for the communities across the nation to improve the court and community response to individuals with serious mental illness and behavioral health conditions. So thank you for letting us be here.
That's a lot to follow. I'm going to make it simple.
Yeah, thank you.
Lonnie Tortorelli, Spokane County Probation.
Samantha Walters, I'm the community group manager with Manzanita House.
Ian Marks Waters.
Maggie Yates, deputy city administrator.
Matt Vinci, I'm the Fire Chief for Spokane District 9.
And I'm Kelly Keenan, I'm from Spokane Housing Authority.
Alex Jackson will take your health system.
Jim Murphy, retired Superior Court Judge.
Mike Sparber, Senior Director of Law and Justice.
Rochelle Cleland, Director of Sexual Assault Services at LCSNW.
Matt Coles, Assistant Chief, Spokane Police.
Katie McNulty, Spokane County Prosecutor's Office.
Good morning, I'm Justin Lindgren, Under Sheriff, Spokane County.
Tony Hazel, Spokane County Superior Court.
Jack Heath, CEO of Washington Trust Bank.
Nick Antish, City of Spokane Public Defender.
Justin Bingham, Spokane City Prosecutor.
Colin Charbonneau, County Public Defender.
Eric Lamb, Spokane Valley Deputy City Manager. Chris Bowles, Spokane County Jail.
Qatar Johnson Jones, Gabriel's Challenge.
Stacy Coles with Coles.
Matt Albright with Providence.
Alicia Barbieri with Goodell Barbieri Company and also current chair with DSP.
Hello, John Brown from Shaw's Health, and welcome to our audience.
It was beautiful.
Good morning, Carl Ottershoe, Spokane Transit.
I want to see the markers are still organized. Dr. Franklin Alaska, Hub Officer, and I did organize the markers by color in a straight line, so please keep them that way.
I messed it up,
Adam Swiniard, Superintendent of Spokane Public Schools, and we did have a little bit of debate on whether we would organize them by primary color or shade of color, so, but we'll work it out throughout the day.
Stanley Hillwood, Justice on Jails.
And Jeffrey Bell, Task Force Communications Coordinator.
You should go. You didn't.
They introduced us, but Alicia Benson, Greater Spokane Incorporated.
And Landsback Valley Chamber of Commerce.
Good morning and all welcome back. Is the mic on? No? No.
I think so.
Just before we start, at the last meeting, none of us were happy with how the room set up was, so we found a new beautiful place. And we are trying this setup today. So any feedback on, what's the best way to work together and see each other, just let us know because we will keep experimenting. So we're going to do 3 things at today's meeting, and it is going to be more of a dump of information and questions, but by the time we get to the next meeting, that's when we're going to need you all to participate in discussion. So there's just a lot to get through in the beginning. So today is going to be some good information pushed at you. So 3 things we're doing today. One is, as you heard, we spent the last day and a half looking at the assets that you have already in Spokane and how they might be organized better to serve people better and cost you less out of your tax dollars. 2, you've seen some work up here, and I'm going to introduce Sue in a moment. We want to start developing guiding principles because starting after you'll see on your agenda kind of a draft list of what the meetings are going to be like going through to the spring. We're going to have to start having some discussion and setting priorities. So we want to set some guidelines and values that we can test the ideas that we have against. So we've started doing that. If you have some ideas, put it up on the wall or leave us a Post-it note. We will collect all those. And at the next meeting, we're going to sit down as a group and figure out what those are. So that's the second thing we're going to do a little bit of today. And then the third thing is we need to start talking about we need to talk to the community to inform them about what we're doing and so start to build support. So we're going to start the community engagement process, just start talking about that today. And at the next meeting, we're going to spend quite a bit of time talking about how do we go out to the community with what we are working on. So those are the 3 things that we're going to do today. So I think first, I'm going to introduce you to Susan Garner, who is a colleague of mine who specializes in community engagement and planning. And she's going to be here to run the community engagement next time, but I wanted her to give a start. And she's going to talk a little bit about that later too.
Yeah. Hi, everybody. Sue Garner. It's Sue Saison, but don't worry, you don't have to say that. Sue is just fine. I am the Deputy Director of Community Building with MIG. And so my work mainly focuses on equitable engagement, stakeholder engagement, moving along the process, ensuring that we have really strong consensus building. So I will be talking a little bit later about our initial approach that we will be getting into December 4th. I wanted to also pull your attention to this question that we have. And I appreciate the conversation around the pens because I overheard that. What values should guide the task force's decisions when perspectives and experiences differ? So as Kate said, we want to start building a common set of shared values that will turn into guiding principles. I understand that we are not going to agree on everything, but what this will help us do is when we get to those moments, we can check ourselves and check back to why we are here, the importance of what we're doing. So if you haven't yet, or if you want to add some more things, please do. This is going to be coming back December 4th. So if you're not sure, if you want to wordsmith yourself, that is completely fine. You're going to see this again next month, but we just really wanted to get a good head start on it.
Apologies for murdering your name.
No.
Just nervousness gets you there. So I think with that, I'm going to turn it over to Judge Lightman. Patty, we're going to go through what we found in the asset assessment, and you have some material.
Is it working? Is that helping at all? I don't think, doesn't sound like it. Oh, well. I will speak up. So thank you so much for the opportunity to be here. As I mentioned, my name is Steve Leisman, and I was on the bench in Miami-Dade County for 30 years. And what you learn as a judge is that in many ways the criminal justice system is the repository of many failed public policies. And there really is no greater failed public policy in our country than our treatment towards people with serious mental illness. The fact that we have used a criminal justice model to address an illness truly explains why we have failed significantly. And the costs in both human terms and financial terms are exorbitant. Last year in the United States, we spent over $1 trillion in direct and indirect costs related to incarceration. More money is spent in this country putting people in jail with mental illnesses and treating them. And so the system, unfortunately, is upside down and backwards. It's not nefarious, not one party or one institution or individual created this problem, and not one party or individual or institution is going to fix it. It truly takes this level of collaboration to restructure and modernize our system. It's really almost a perfect storm that occurred over the last 60 years. We have not kept up with the science. Our laws have not kept up with the science, the research, or the medicine. We are still locked in a system that was developed 60 years ago before color TV, forget iPhones, and computers. And so part of what happened is this perfect storm occurs where you have deinstitutionalization, you have a war on crime and drugs, you have massive cuts to housing, you have sentencing guidelines, and we threw a group of individuals out into the street expecting miraculously that somehow they would recover. It goes back to another premise. And the premise is that when community mental health was designed in this country, the most acutely ill population, those with psychotic disorders, were in psychiatric hospitals. The community mental health in the United States was actually designed for moderate mental illnesses, not acute. And so when those things happen that I just mentioned, our communities were not prepared, nor were the providers prepared to handle such a sick and ill population. And so naturally, they failed. And instead of taking a good hard look at ourselves to rebuild a system that accounted for the needs of this very ill population, we have used the criminal justice system to handle. And it will never, ever work. I will tell you, in Miami and many other places that we've been, the answer has been the business community. And that's why I am so excited, and Patty and our other partner Rick, and honored to be here with all of you. Last Saturday, I attended the 30th anniversary gala of something called the Chapman Partnership in Miami-Dade County. The Chapman Partnership is named after Alva Chapman, who was the publisher of the Miami Herald. And he recognized this very serious homeless situation that we had 30 years ago in Miami-Dade County, Florida. And it was only getting worse. At the time, we had about 8,300 to 9,000 people on the street, unhoused. We were trying to use the criminal justice system to resolve it. it only got worse. And it only became more problematic. Not only ended up in court and lawsuits, and nothing was really being done to fix it. And so Alba, with his great moral authority, brought together the entire community to sit down like we're doing here today, to come up with some real solutions. And but for Alba's moral imperative, but for our business communities and our political community coming together, we never would have created what we call the Chapman Partnership, which then led to the creation of a homeless trust, which then led to a tax to be able to pay for housing in our community, which then led to a reduction in homelessness from 8,300 to less than 1,000 today. And I live in a community that is 3 to 4 times bigger than yours, and per capita has next to nothing in homelessness compared to this. And we did it because we came together, we all started rowing in the same direction, and we developed a system that actually works. It's complicated. There is no easy fix. These are human beings with very complex and different needs. But what I will tell you is that after 30 years, we have eliminated, for the most part, economic homelessness and veteran homelessness. The 878 people who are left on our streets are a different population than those that we were able to address. The ones that are left on our street are people mostly with serious mental illnesses and substance use disorders. So we are now in the process of restructuring our strategies on how to get to functional zero by attacking that last group that are on the street. It's a little misleading to say we just reduced homelessness from 8,300 to 878, because in between, in every year, we avoid homelessness for over 13,000 people. We have actually broken the cycle of homelessness for over 145,000 people. And our population over the last 30 years has significantly grown. If you've been to Miami, we have more scaffolds in Miami-Dade than the rest of the country combined because of all the economic development. We still can't keep up. We're sinking, but it is a beautiful place to live. Nonetheless, there are great strategies to do this. And it's truly a fixable problem. Last October, I had the privilege of being part of a delegation that was funded by the Hilton Foundation that sent us to Trieste, Italy, to go study the Trieste system. Now, for those that were with me the last 2 days, I hate repeating any stories, but I will tell you, we didn't go there because they have the best coffee and chocolate in the world, and we didn't go there because they also have the best Prosecco in the world, and trust me, they do. We went there because they are known as having the best mental health system. They virtually have no homeless. They have no one in their, well, I shouldn't say no one. They have very few people in their forensic state hospital. In fact, when we visited, there were only 2 patients at the hospital. There were more staff than patients. They virtually have no one in their civil state hospital. It's not that they're locking people away and hiding them from the rest of the community. It's that they, A, don't identify people by their illness. They are members of the community that need to be respected and treated well. But it's that they apply a population health. Here to fix the mic. They do it by applying a population health model. That was fast. Instead of a criminal justice model. And so when there is a crisis, they don't send a police officer to handle the situation. Does that help at all?
Yep.
Okay, thank you. They send a psychiatrist out to the scene or to the individual's home to address the situation. And they try to get the person on medication immediately. And they allow the person to stay at home. If the person is too ill to stay at home, they do not immediately file a petition for civil commitment, even though their civil commitment laws are much, much more liberal than ours and very easy to do. It's based on a need for treatment, not imminent dangerousness to self or others, but they don't need it. Out of 40,000 patients last year, they only filed 100 petitions for civil commitment. We file 100 petitions a day in Miami-Dade County. They do it by getting ahead of the situation. And what they do is they get the person housed that day. And they assign 3 case managers to that individual. So someone is with them 24 hours, 7 days a week until they begin recovery. And once they are stable enough on oral medication, they can switch them to a long-term injectable medication. And once the recovery begins, they don't just let the person sit around and do nothing all day. They have one of the most amazing supportive employment programs you will ever see. And because the state civil hospital has very few patients, and it is a beautiful facility, they have turned it mostly into a supportive employment facility. And so the patients run a radio station, they run a restaurant, and they have this very chic clothing manufacturing plant right on the campus where they make some of the most amazing products where people come from all over Italy to buy their products. And so the individuals have a purpose in life, just like all of us. They have a reason to get up every single morning. And they're managed and they're supported. And so they're not decompensating where they end up on the street and they have to use an acute system of care to deal with the situation, which is the most expensive and the least effective to deal with this situation. And so part of doing all of this is getting upstream to keep people from ending up in an acute system of care. And what's an acute system of care? It's jail, it's hospitalization, and it's competency restoration. And all of us are dealing with that struggle. Bless you. And our response in this country has been to just keep pouring more good money into bad systems, hoping it will get fixed. It's really the definition of insanity, where we keep doing the same thing again and again, and we expect a different outcome. And trust me when I tell you, because I know firsthand that we can do better and we can literally fix this. In my own community, a little over 25 years, almost 26 years ago, I had a case involving a defendant. I'm not going to retell this story because a third of you heard it Tuesday. But suffice to say, the defendant turned out to be a Harvard-educated psychiatrist who had a late onset of schizophrenia. He had a full-blown psychotic episode in my courtroom. I followed the law and I followed all the rules and I ordered all the evaluations that cost tens of thousands of dollars. And the only thing I was allowed to do with his case, because it was only a misdemeanor, was to throw him back out to the street and wait for him to come back next time. None of us in this room go into our professions to be part of a problem. And that's what we're doing. And again, it's not nefarious, it's not political. It's just that we are all so busy doing our jobs. There's nobody who is accountable to make sure that this individual who is incredibly ill gets the level of care that they need to stay out of these acute systems of care. And then we all get mad at each other because, you know, we want a quick fix, we want an answer, and we think it's political and we don't trust anybody anymore. It's not that at all when it comes to this situation. They're just really sick people. And so as a result of this psychiatrist's case, and I will tell you, and Murphy will appreciate this, one of the best things about being a judge is when we invite people to meetings, they come, even if they don't want to be there. And so I invited all of the traditional and non-traditional stakeholders to come to a 2-day meeting in Miami. And we brought in 3 outsiders. In fact, one of them was from Seattle. David Wertheimer, I don't know if any of you know him. David was head of the King County mental health system, and he went on to run the Gates Foundation. Amazing human being. And as Judge Murphy and I were talking, the definition of an expert is someone who lives 15 miles outside your jurisdiction. And so for us, David was the best expert because I think Seattle is about as far away as we could get from Miami. So I am a great expert too then because I am returning David's favor and paying it forward. But really, it helped. And we had 3 amazing experts in a room like this and in a room like we had the last 2 days that mapped out the intersection between the community mental health system and the criminal justice system. And we figured out what assets were available, and we started to coordinate care, and we made true structural changes. And we realized we needed to do a 2-part approach. And if I had to do it again, I would have made a 3-part approach. And so I am thrilled to see the superintendent of schools here because they are a big part of how we fix this long term. I'll talk to you about that in a minute. And so our 2-part approach was, and I would say using the sequential intercept model, but it didn't exist yet, except the woman who is the mother of the sequential intercept was one of our experts. Our 2-part approach was this pre and post arrest diversion system. And we looked around the country, and the best pre-arrest system that we found at the time was out of Memphis, Tennessee, called Crisis Intervention Team Policing. This is a 40-hour training program that teaches law enforcement how to identify people in crisis, how to de-escalate situations, and where to take people as opposed to arresting them. Because you can't fix it if you're a hamster on the wheel and you keep going around and around, and the population keeps growing in jail. You want to slow down that growth. So you want to reduce the number of people coming in. And so we now have the largest trained squad of CIT officers in the United States. We have over 8,800 officers trained. And the results have been stunning, far exceeding anything we could have imagined. Our project was not about building a mental health court. While they play a role in this, statistically, not much if you don't use it right. They generally only take about 1/10 of 1% of people that need the help, and they usually take the wrong 1/10 of 1%. They take the low risk people that aren't coming back anyway. And with all the data and everything we do and everything we're going to talk about today and everything we spoke about the last 2 days is based on research, data, and evidence-based practices. And so what we went in to do was not develop a mental health court, because that's easy. We went in to do a structural change and created a diversion system for the entire community. And so our pre-arrest, just to give you an idea of its success, we keep data on every single mental health call that our 2 largest agencies handle. And over a 10-year period, these 2 departments alone handled 105,268,000 mental health calls. And out of those 105,268,000 calls, they only made 198 arrests over 10 years. The number of arrests in Dade County as a result of that part of the project went from 118,000 a year to 53,000. How many arrests do you have in Seattle, whole county? Spokane, sorry.
Average is 26 a day.
26 a day. Okay, times 365. What's that real quick? I'm a lawyer, not a doctor, so we're doing the math.
Little over 1,000.
A little over 1,000. Okay. It's not bad.
No, that's wrong.
Right. But we lowered our arrests by more than half. And a bunch of things happened that we had not even anticipated. Our police shootings almost stopped. Why? Because as we were doing all of this training of law enforcement, we discovered something that we had not anticipated. The extremely high rate of PTSD among police officers. And the woman that runs our police training gets between 150 and 250 calls a month from police officers that she has trained for their own personal mental health issues. Last year in the United States, more officers, it's not just last year, it's been almost every year, more officers die from suicide than in the line of duty. And not only do police officers have high suicide rates, they also have high domestic violence rates, substance use rates, and divorce rates, almost entirely tied to their own PTSD issues. And so as a result of learning that, we put together a treatment program for our law enforcement officers, because what we found is that they would not go to their departments for help, even though the help was there for them, for all the obvious reasons. And so we set up a system to get our officers treated outside their departments. And what a difference it made. So well that the city of Miami's police shootings went from 90 in the 5 years before CIT to a handful in the last year. So well that when the mayor of Miami went to New York to get his bond rating reviewed, at the end of a 3-hour presentation of how great our economic development was in Miami, the bond reviewers only had one question. Mr. Mayor, great on all your economic development, but how did you get your police shootings down so significantly? And why is that important? Because municipalities and counties are self-insured. There's no insurance policy on police shootings. So whenever there was a shooting, there was a lawsuit. And when you had 90 police shootings, you had lawsuits that all settled for hundreds of millions of dollars. And where did the money come from? The taxpayer directly, right out of the budget, hurting their bond rating, costing taxpayers hundreds of millions of dollars in higher bond rates because they weren't doing things right. And by lowering the police shootings, the city saved hundreds of millions of dollars just by getting their bond review improved, bond rating improved. Doing this right is great for everybody. And that's the point. It's one of those rare instances that every single person wins by doing this right. Our law enforcement win, our business community wins, we reduce our homeless population so they're not on the street bothering businesses. We're improving our public safety so our citizens win. And we're giving people who are just sick an opportunity to have a life of hope and opportunity that they have been deprived of as well. So everybody wins. We knew, though, that just doing pre-arrest wasn't going to be enough. So we set in a post-arrest diversion system. We totally changed our screening at the jail when somebody got arrested. And we started using validated tools. And we made sure that the person doing the screening was a professional so that we got the best data back. And when we identify now someone with a misdemeanor in Miami-Dade who has serious mental health issues, we do not rush to order a bunch of psychological evaluations for competency that do absolutely nothing except keep the person in longer, help them decompensate, and put them back to the street in worse shape than they were when they got arrested. Endangering public safety, endangering them, and costing taxpayers millions of dollars unnecessarily. Now what we do is, if you're in on a misdemeanor and you're identified and you meet certain criteria, within 3 days of your arrest, you're diverted from the jail to one of our crisis stabilization units. And because they are on a criminal hold, the 72 hours under our civil commitment law does not apply. So we reset the case for 2 weeks, which is what most of this population actually needs. People don't understand 72 hours for civil commitment has nothing to do with treatment, has nothing to do with getting someone in recovery. It is a judicial review to make sure that we're not holding someone unnecessarily. But what this population really needs is a couple of weeks of stabilization. And then what they need is a transition program, not to go back to the street, but to do what Trieste does, is to find them housing, case management, and a medication protocol and a job so they can not only recover, but thrive. Within 2 years, our recidivism rate went from 75% to 20%. It worked so well that our state attorney realized that if you truly want to improve public safety, you have to get people treatment. We have 2 options here, and they're not complicated. You can either release people from jail with treatment or you can release them without. That's it. And what most people don't understand, unless you're a judge, you're in or a prosecutor or a public defender. I was thrilled to see the prosecutor sitting next to the public defender. That's a good sign. Most people that go to jail, not prison, are out in like 90 days. It's a very short stay. And what we all do is when these very ill people come in, we release them pretty quick. And they're often in worse shape than when they came in. So they go back out to the street. They're almost all co-occurring, meaning they have both a serious mental illness and a substance use disorder. And almost all of them are homeless at the time of arrest. In fact, in the United States, this is really stunning and not a good statistic. 70% of people in jail in the United States either have a serious mental illness, a substance use disorder, or both, which has brought me to the conclusion that what we might need in this country are specialty courts for the 30% that don't.
Can you say that stat one more time?
70% of everybody in jail and prison in the United States either have a serious mental illness, a substance use disorder, or both. I mean, just ask your deputy chief here. He knows because he is a mental health social worker today. Because 70% of his arrests are involving, and here it may be a little worse because of your fentanyl crisis. It's all they're dealing with. Real crime's only 30%. Not that these folks aren't committing real crime. It's just that we're not addressing what's causing the crime. And so maybe what we need is a therapeutic jurisprudence system that addresses the 70%. And that's why I think we were so successful in Miami, because again, it wasn't a mental health court. It was a diversion system where every misdemeanor qualifies and all nonviolent felonies. And now we've even gone beyond that because we see that there are some cases we're better off getting someone treated than incarcerated. But I will tell you on the other side of this, our program was never about not sending people to jail. There are some people who, because of what they do or other issues that they are dealing with need to be incarcerated. It was about sending the right people to jail and getting the right people out into treatment that we did not feel were a risk to our public safety. People with mental illnesses are no more dangerous than the general population. Now, it goes up a little bit when they're on drugs. We know that. So we have to address both. But on medication, people with mental illnesses are less dangerous than the general population. So as I said in my discussion the other day, since it looks like we're getting rid of fluoride in the United States, maybe we should just put antipsychotics in the water and we'd all be better off. So seriously though, we know that treatment works. Just getting access to it is difficult. And people with mental illnesses take their medication about as well as people with diabetes. Not all that great. And the consequences of not taking treatment, it's not good. So we have to address it, and we'll talk about that in a minute. Our recidivism rate among our felony population went from 75% to 6% for those that finish the program, which is the vast, vast majority. And it may be a little counterintuitive, but the people charged with felonies are a lot easier to deal with than the people charged with misdemeanors. And we know why. It is because we now know today something we didn't know when our civil commitment laws were written or when our community mental health system was designed and developed, is that the longer someone stays in a psychotic state, the more likely the gray matter in their brain is getting destroyed. And by doing things the way we do it in this country, we are allowing an entire group of individuals to become permanently disabled. And it becomes a lot harder to get people treated. And it's a lot harder when their baseline is so low and we can't get it to a certain point anymore for them to have a life of recovery. And they are becoming permanent wards of the government. And they're not easy. And they're frustrating. And they're frustrated. And that's why Trieste works so well. They don't wait. We wait. We'll let people stay on the street for decades while they become permanently disabled. Look, I'm a civil libertarian. I believe in individual rights, but I just have not figured out what is civil or right to allow a man or a woman to live under a garbage dump outside eating cat food and thinking that is okay. Because it is a very weird, bizarre discrimination to me. Because if somebody had a heart attack, step over them, we wouldn't walk past them. We would involuntarily treat them. In fact, we would cut their chest open and do a bypass without their permission to save their lives. But if they have a heart attack of the brain where they become psychotic, it's like it's okay. And I don't understand why we continuously do that. And there are strategies to protect individual rights and to try really hard to get people to voluntarily take treatment before we need to get to that level. And that's what needs to be done. But at some point, just allowing people to remain ill out on our streets is inexplicable to me. And it's unnecessary to me. We imposed a lot of strategies to get where we are in Dade County. There, unfortunately, is no one fix to any of this. It's a little nuanced, but some of it is really elegant and uncomplicated. And part of it is just learning the depth of the illness and the right way to talk to human beings. If you talk to a neuroscientist, they will tell you that the brain's primary function is to develop relationships with other human beings. This population has severed every relationship they've ever had, family, friends, etc. And so they are very, very isolated, which physiologically is damaging their brain. It's like when people retire and don't do anything, they get depressed. The blood flow isn't the same, they're not getting the stimulation, they're losing contact with other people. These people haven't retired, but in a way they have, and they're isolated. They also have a condition that we didn't understand till more recently called learned helplessness. Some of the medical folks in the room will understand that. It basically means they have clinical depression on top of their mental illness. And when they come to court, it's not always that they lack insight to their illness. It's not always that they just don't want to get treatment. It's mostly they don't care if they breathe anymore. And we're civilians. I call us civilians if you're not someone with lived experiences. And we think, oh my gosh, if they just take their medication, everything's going to be great. Well, sometimes it's worse because now they're aware they're living under a bridge. Now they're aware they're eating dog food to survive. Now they're aware they're getting beaten up and abused out on the street. Sometimes they rather stay in the fog. And so when we do this, the first thing we have to do is figure out how to incentivize them to want to get better. And so how did we do that in Miami? Before COVID, a third of our staff, and our staff was about 24, 25 people, 8 of our staff members were people with lived experiences, peers. And half of them were graduates of our program, which incentivized them to continue in their own recovery. And our peers were the secret sauce of our recipe, incredibly inexpensive, incredibly effective. And what they did so beautifully and elegantly is they re-established relationships for this population, which then incentivized them to want to start to get better. And how the judge talks to this population makes all the difference in the world. And how our providers and our social workers and our police and our EMT talk to this population makes all the difference in the world. And that's what they were doing in Trieste. They're just people who don't want to live the way they want to live, but they're so sick, they don't know how to get out of their own way. And when you do it right, you get the kind of results that we got. And what was so wonderful about the last 2 days is that when we did an asset assessment, you should be really proud of what you have here. You have great assets. Now, like everybody else, they're not coordinated. They're a little chunky sometimes. They're not open and available 24/7, 7 days a week, like they're going to need to be. Because I hate to tell you, maybe this will surprise you, but these illnesses don't work 9 to 5, 5 days a week. They're just like primary health issues. They need to be, treatment needs to be accessible all the time. Could you imagine if you had a heart attack and you had to wait till Monday to go get help? That's what we're doing. And that's what you're doing here a little bit. You're also doing a couple things that the rest of us were doing that are kind of the easier, quick fixes that we think we can help you with. You're discharging people with serious mental illnesses from your jail at 3 in the morning. Very fixable. You already started that conversation yesterday. You're only going to put them back into homelessness when you do that. You're discharging people from crisis units and hospitals without a transition plan, only putting them right back out on the street. doing no one a favor. Again, it's not anybody's fault. There's not a bad thing, person, or institution in this. Nobody wants to see this. I don't care if you're super liberal or super conservative or moderate. We all know that's not right. And so we will work with you to implement strategies quickly to start to address some of those quicker issues. We also know something else. And again, I think he stepped out. And that's why I'm thrilled the superintendent of schools is here. That most of this population who are in the criminal justice system with serious mental illnesses have horrific, horrific histories of trauma. 92% of the women in jail and prison, Judge, you want me to repeat that again too? 92% of the women in jail and prison in the United States with serious mental illnesses have horrific histories of trauma, mostly sexual abuse as little girls, 5, 6, 7, 8-year-olds. 75% of men in jail and prison in the United States with serious mental illnesses also have horrific histories of trauma. Sometimes sexual abuse, more likely they have been victims of long-term domestic violence, or they have witnessed violence like a soldier will see in combat. And a young brain that is not fully developed, which is not developed till 25, where the frontal lobe is not connected, when it is exposed to that kind of trauma, it is physiologically damaged very badly. In a young brain that's damaged, it's damaged more than in the adult brain. And instead of addressing and embracing a child who's hurting, what we generally do is we punish their behavior because they're going to be the first people acting out in school. So we re-traumatize them. And I will tell you this, most of that horrible trauma we're talking about isn't being done by a stranger pulling your kid off the street. It's familiar. It's happening at home. And trust me, I sat in dependency. I don't know if our judges ever sat in dependency. It is the most difficult assignment a judge will ever have. Because the horrors you see every day, knowing there's little you can really do about it, is horrifying. And so we need to move upstream. And that's why I'm thrilled the superintendent is here, because we have to start identifying kids that have been traumatized or are currently being traumatized, stopping the trauma and then getting them treatment, because there's great treatment. We are piloting a treatment program for children with serious trauma in Miami, and the outcomes are phenomenal, phenomenal. And so we want you to work, you know, we all can chew gum and walk at the same time. We just don't work on fixing one piece of this. We start working quickly to address the trauma issues. So in 10 years, you've kept generations out of your criminal system and off the street. This is the way. Trauma's physiological. You can look at an MRI today of a person with and without trauma, and the brain activity is substantially different. Substantially. And so we need to intervene early. How many of you have heard of ACEs? Okay, it's pretty good. Third, quarter, almost 50% of the room. It stands for Adverse Childhood Experience. It's 10 questions. It's not really an assessment tool. It's more of a research tool. But what we know is if you have a score of 4 or above, you pretty much have a 100% chance of having a serious mental health and or substance use disorder. Because this is the way it works. I have a kid. I know life. Kids experiment sometimes. So if you have a child with trauma and a child without trauma experimenting with drugs, the one with trauma feels a heck of a lot better for the first time because the fire goes out in the brain, at least temporarily, from the drug. And they feel normal for the first time in a long time. So they start using. The kid without trauma thinks it's disgusting and doesn't do it again. And that's why we end up with all of these kids with trauma in our criminal justice system pretty soon, and lives ruined. And boy, the drugs today are a lot more potent than they were when I was a kid. They kill you quickly, permanently disable you. Meth is not something you come back from. This stuff is hell. And so we have to get ahead of that. Just addressing trauma among children is going to help you in ways you will not even imagine and build you a much healthier and safer community. Now, I had this one case, and then I'm going to get into some more of what we did the last 2 days. I was covering our mental health docket one morning, and there was a woman in jail on a low-level offense. And state attorney was offering her credit for time served because she had been in long enough to cover the time on her sentence. And she had a really long history of serious mental health issues. And I did not want her to take a plea. And so I started talking to her. And I asked her, because I do this in all of my cases, it was one of the things I learned early on that really helped me communicate with people with mental illnesses. The first thing I always ask someone in court now is if they mind if I ask them any personal questions. You know, I wouldn't ask a woman in court how her breast cancer is, so I don't know why I should be asking how your psychosis is in open court. And let me tell you, if they're in jail and there's a bunch of other inmates sitting in court with them, you start asking questions like that, you make them very vulnerable in jail. So we have to be careful. We're part of the problem when we're not educated. I'll tell you that. We know that now. And that's why the Conference of Chief Justices and State Court Administrators, the report that Patty talked about, is so important because we are now re-educating every judge in the United States. And it's fascinating to watch. So the first thing I asked, do you mind? So I asked her, do you mind if I ask you any personal questions? And she had a lot of attitude, this woman. She's pretty young. She said, yeah, I mind. So would you feel more comfortable coming up to the bench and having a more private conversation with me and your lawyers? Okay. Always freaked out my corrections officers. But anyway, I brought her up to the bench. We started to talk. And she had a lot of attitude with me, which was fine. You know, I couldn't imagine what it was like to be in her shoes. So try not to be judgmental. And I said, what can I do to help you? Which is the second question I always ask someone now as a judge, because it totally changes the dynamic. Instead of asking them what's wrong with them, you ask them, what can I do to help? Didn't get much of an answer. So I said to her, I don't know anything about you. I know a little bit about your case, but I don't know your history, your family. But what I do know is that most of the women who are in jail in this country have had really horrible histories of trauma. And if that includes you, please tell me what I can do to help you. All of a sudden, she started to cry hysterically. And, you know, when you're in court, you want to move cases quick. There's a million more behind each one. We're not the most patient people in the world. And so we waited, and she cried hard for about 5 minutes, which is an eternity in a courtroom. Corrections came up and brought her Kleenexes. And finally, between her tears, she said, Judge, when I was 4 years old, my father brought me to a bar and I was raped. And it happened on multiple occasions, leading me to conclude that he must have been selling her at the bar. And then she said something, I can't say worse, but was also pretty awful. She said, you're the first person I've ever told. She had to come to court and tell a total stranger
her deepest, darkest secret, because no one ever asked her. And she was now in her late 20s. Had we intervened with this woman when she was a child, because her behavior got bad quick, we let her, a victim, grow up into a system that only abused and re-traumatized her again and again. And after we had this amazing breakthrough, I asked her if she'd be willing to go for treatment because, of course, she had a very serious substance use disorder on top of her serious mental illness. And she needed inpatient treatment. And she's being offered credit time served to go home. And those drugs are just waiting for her the second she leaves. So she said, I'll go in, but I want to go home tonight and see my children. Toughest decision of a judge. Why? Because most overdoses occur in that 24 hours after release from jail. But I had her confidence, and I didn't want to lose it. She was offered credit for time served. So I said, okay, but I need you back first thing. She left the courtroom. Can you believe it? Everybody in my court made a wager against me. They're like, Judge, that was a mistake. She's not coming back. Blah, 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 blah. Well, the next morning, she showed up a half hour early. We put her in a long-term drug treatment, in-house residential program, and she did amazingly well. Now, not every case turns out magically, but when we do it right, it makes a huge difference. And so we know what works today. All the research is there. We have lacked the political will, and we have not had the capacity or accountability to make it work right. And so at this point, I'm going to stop, and I'm going to turn it over to my partner, Patty Tobias, who's going to talk about the priorities and opportunities and assets that we came up with the last day and a half. And then we'll talk more about how we're going to implement those wonderful changes. Thank you all very, very much.
Okay, and hello, thank you. So,
I was like, it's like the mystery box.
your table has 4 pages with a paper clip. Please grab one of those. There's 6 on each of the tables, so everybody should have one. Did everyone get one? Okay, great, thank you. So what you have is the Behavioral Health and Justice Asset Assessment Agenda. And it's, many of you spent the last day and a half, but just for those of you who didn't, what we tried to do, I hope successfully, is acquaint all of you with the Miami model, with the successes that not only Judge Leifman has seen, but what we've seen across the nation. Between the 3 of us that are part of the Leifman group, we have served or worked or visited or provided assistance to each. Can you hear me? Okay.
You want to move the microphone like this? Closer to you. There you go. Perfect.
There? Okay. Sorry. We have worked in almost all of the states, I think actually all of them. But what we tried to do was talk briefly about what a population health model is. But more importantly, we identified ahead of time all of the assets that Spokane has from reviewing multiple reports and building on those reports. So each of the participants had a master list of the assets in Spokane and the gaps that we saw in Spokane, or not that we saw, that you all contributed to those lists. And we also received a lot of feedback from questions that we asked ahead of time. So again, for those of you in the room who responded, thank you so much. You have the beginning of really solid listed assets and gaps. Throughout the day, we added to those assets and gaps, and one of our final reports to the committee or to the task force will be that list. We also discussed and highlighted opportunities that you would have moving forward. The first day I talked about, oh, you've got lots of assets and let's build on those assets. The second day, we talked about those opportunities. And we highlighted those opportunities, and I will show them to you in just a second. And we also broke out by the different subcommittees, proposed subcommittees, so that we could bring you, the task force, that information today to kick off the subcommittee discussion. And you could get, and they got started on action items, and that's included. What we're going to do now is, not now, following this task force meeting, is prepare a final report for you of the asset assessment, those findings. We'll add on the additional information that you provided, and we'll have that for you for your next task force meeting. Now, going into your second page, behavioral health and justice asset assessment, priorities and opportunities as identified by the attendees. And we highlighted, we asked each of the attendees to, they got 5 votes for their individual priorities that they wanted to have. So did you get a sheet? Okay. It's got yellow on it? Yeah. Okay, thank you. And so I'm just going to highlight some of these, but this is your list of items that were discussed on the first day and brought to us. So many under the pre-arrest and crisis response. So there's some work that you could do in that area, expanding the crisis intervention team and other co-responder models, develop a pre-arrest deflection system that's linked with 911 and 988, and strengthen that continuum of care across law enforcement and behavioral health providers. And that was one of the set of priorities. Also, post-arrest diversion and court collaboration. Build that comprehensive post-arrest diversion system. Judge Leifman talked about it. You've heard about it, and I know there's a considerable interest in doing that. Treatment and infrastructure and continuum of care, assess and increase the treatment capacity. And as Judge Leifman mentioned, it's got to be 24/7. Establish that crisis stabilization unit. You've got it, but I understand it has limited capacity from those in the room the last 2 days. And develop that discharge planning. You heard Judge Leifman talk briefly about it, but the discharge planning and the reentry planning from hospitals, from jails, from all care units. And then on the next page, reentry housing and employment, the data research and technology, the standardizing the data collection. My understanding and what we heard over the last day and a half, you have data. You have data, but it's in pockets and it's not standardized and it's not shared always. So that's going to be a big area of opportunity for you. Judge Leifman also talked about ACEs. And that was an area for screening and early intervention that the group prioritized. And finally, building that integrated system of care from that links behavioral health, the justice system, housing, and healthcare sectors. Those are the priorities, but frankly, it's just a start for you. It's just a beginning for you. There are many others on this list that you could also choose to go forward with, but this is the starting point as recommended by those that participated in the asset assessment. But these are only recommendations to the task force. It's your job to identify the priorities, to identify where you might be able to have a quicker win, or those recommendations that are going to be longer term. At this point, I would like to ask Kate how you want to proceed with the discussion of the subcommittees.
I think, so you see the first list of priorities. We want to do the model that was so successful in Miami, where groups of people with information in the different areas sat down and sorted through the priorities and figured out how they might happen. And you will see, and how they might be accomplished. Starting in January, we're going to want subcommittees coming back to us with ideas who have really talked through these options. And so I'm going to have Patty tell us what the subcommittees are and take us through the handout. Today, we want you to take a look at what those subcommittees are, and we would love for any of you to volunteer to be on them, because that's where the change recommendations for this community are going to happen. So Patty, if you take us through that handout of what those, and what the items and tasks that might be in each committee, that would be great.
Hi, me again. So your next piece of paper is, thank you. I've got a little helper in the background. So it's called the Safe and Healthy Spokane Task Force Subcommittee Framework and Focus Areas. Everybody have it? Okay. So we're recommending, in consultation with task force members, 4 separate subcommittees. And they're broken out by what we call the sequential intercept model, which many of you are familiar with. But for those of you who are not, we also had plain English. The crisis lines, well, and each of the 4 subcommittees would be data-driven, and they would be coordinated to the overall challenges in Spokane. And it'll be important that we coordinate, we, the big we, coordinate across those subcommittees so that they're on a good path forward. So the first subcommittee is really where we start oftentimes, and that's the crisis lines and crisis response. For those of us who work in this behavioral health and justice area, that's intercept 0 and 1. And I know that you all have done a lot of work in that area, but it's really focused. That pre-deflection area is so important because that may be that first crisis that individual is having. And if we can intercept that individual, connect them to care at that early stage, we're going to have much better outcomes than if it's 10 years of psychosis and then trying to connect that person to care. As Judge Blakeman mentioned, the brain matter is just not there sufficiently. So the second and in some of the areas we've listed for that subcommittee would be, again, that entire crisis response, starting at 988 into 911 and that communication between them. Crisis intervention team, I know you all do some training in that area, that what are de-escalation techniques, that's a very important area. Developing that pre-deflection pathway, underscore that. The earlier we can move that person into care, the better success we will all have.
And I would just add on that, and that would include the trauma issues and working with the school and the pediatric association in the community, because we need to start screening elementary kids for trauma. And so sometimes it's hard to do it in a school for all kinds of various reasons. But when a pediatrician is giving a child a checkup, There's no reason they cannot be checking up on their trauma and psychiatric issues at the same time. And so if you can do that as part of subcommittee one, you will put yourself on a wonderful path to really reduce this problem in the future.
I'll address two other things in this subcommittee. Emergency department diversion programs. Do we have anyone here from the emergency rooms? We did yesterday or the day before. Yes, thank you. What we heard and what we've seen in other communities is that the boarding, we board individuals in that emergency room because either we don't have a bed for them or we don't have any opportunities. I've experienced it myself. So in my family, emergency room boarding, we want to keep people out of emergency.
Yeah, and just, we don't want to use an emergency room as a crisis response.
Yes.
And it's very expensive. Even though you have Medicaid expansion, there may be some coverage. It's very disruptive to other patients. It's very difficult for the doctors and staff to handle it. And you have crisis stabilization here. So one of the things is to think about is how we redirect the population. One of the things they started in Orlando and that Florida's moved to that's been really effective. And I know being from Washington, you may not want to listen to anything Florida does. Sometimes I don't either. But we have central receiving facilities now. And so it's like an air traffic controller system. And so law enforcement or EMT will not take them to exterior airs and ER. They take them to central receiving as long as there's not a primary health crisis with it. And there, it's a 23-hour facility, a great one in Arizona, which is a great model to look at. We could help you with that as well. We work with the person that runs it. She's amazing. And they figure out what the immediate needs are for that person. And they will then direct and transport where the person needs to go from there. And it really works. And the vast majority of those people are stabilized right away. They're put back in the community right away, and they don't need urgent care. It saves a lot of money. And so since it's going to save the hospitals a lot of money, we will talk to them about helping us do this because it's going to be cheaper for them to help us do this than for them to continuously take this population and get really bad results.
Is that what you mean by emergency room boarding?
Yes. Well, emergency room boarding is the officer doesn't know what to do with the person gets stuck staying there. I will tell you something else, and sorry, Patty, I don't want to interrupt. I'll be quick. And this is the bigger problem we don't talk about. This population, if you send someone to a hospital, regular primary hospital with serious mental illness, they're much more likely to be admitted than someone without mental illness. They're going to stay a lot longer and they're less likely to have insurance. And the reason that is because not only are they co-occurring, that's the least of the issue for the hospital, they're all comorbid, meaning they have a very serious mental illness and a very serious primary health issue. And there's a reason for it. One of the symptoms of psychosis, it depletes your dopamine levels and you feel terrible. And so they self-medicate themselves with cigarettes because nicotine stimulates cognition in the brain and makes them feel better. 50% of smokers in the United States have not just mental illnesses, serious mental illnesses, and close to 90 to 100% of people in jail with mental illnesses are smokers. And I could tell in court who had a serious mental illness just by looking at their hands. They're all yellow because they're chain smokers. And when they go to jail or the hospital, they have cancer and heart disease and diabetes. And much of it is from their smoking. And when they go into these expensive acute systems, they have to be treated. And when you go to jail and you have these primary health issues, the county is 100% responsible for the cost. There's no Medicaid, there's no insurance. And they stay 4 to 8 times longer than somebody without mental illnesses. Yes, sir.
This is different than the crisis stabilization center.
Yes,
Correct. Yeah.
this is different. What we're suggesting is you develop a central receiving system where everybody goes there immediately. You have really well-trained professionals that can then determine what they actually need. It keeps them out of the ER. If they need primary health, you can set that up on the outside. You don't need to do it in an acute setting unless they are, having a stroke or a heart attack or something like that. Most of them are not. So we want to put people in the right place at the right time to get the right level of care. Population health, not acute care. Much cheaper and it's much more effective. People are gonna get better as opposed to what they get now. Sorry. Patty's gonna kill me before I.
The second, the only other issue in that first subcommittee is law enforcement wellness. Wellness that you all need, that we all need. We've got to focus on that wellness, but particularly for first responders. The second subcommittee is listed jails and courts. Jails and courts communicating, working together with a real focus on that post-arrest diversion. And I know the subcommittee worked on some action items to really work on what post-arrest diversion would look like. How to have treatment access at the earliest stage. Can they go on a different pathway? So that's the great area. Can we improve the jail screening and assessment and communicating that information to the court and public defender and prosecuting attorney at the earliest stage, so that there are opportunities? But we have to use validated treatment assessments and screening tools, and sharing. And we heard a little bit about Matt, medication assisted treatment is not always available when a person is incarcerated. So again, that training piece is really important. Judges, prosecutors, public defenders, anybody working with individuals with serious mental illness and behavioral health conditions. We all need more training on how to respond, what kind of treatment would be best and most appropriate. So that's intercepts 2 and 3 for those of us who use that language, but it's really the jails and the courts working together hand in hand on that assessment piece and getting that information to the judges at the earliest opportunity so that there are alternate pathways off of the adjudication pathway that we do have. And this comes before a mental health court or a drug court. Those are one part of the solution, but the real solution there is able to divert some individuals, appropriate individuals, into treatment. So, the next subcommittee number 3 is reentry, discharge, and community corrections. Also, so we know it, intercept 4 and 5. And that's that, we call it the seamless transition, warm handoffs coming from an incarcerated state, just not letting them goodbye. You're out the door, no matter what hour of the day. We need to come up with a warm handoff, a transition out of incarceration. What are the reentry supports that an individual might need at that point? Do they need housing? Do they need treatment? Do they need whatever, employment support? What are the supports that are going to make that person successful in their reentry process? So, and using what we always talk about, that trauma-informed care. And there's some other ideas there. The fourth committee kind of goes across all the steps, but it's that infrastructure, it's the facilities, and it's the treatment continuum that we have to establish, or that we want you all to establish, to make sure we're communicating across all of our agencies, our entities, what's happening when. So think about those facility and workforce needs. We heard a lot about workforce shortages, and it's a tough one to address. It's not unique. It's not unique to Spokane. Hopefully we can address it. Working with universities, they'll have courses that can be created if they're not already available, but we have to have some attention on that through this subcommittee. We can draw some lessons from the Miami Center for Mental Health and Recovery. This is going to be the first in the nation recovery center. We offer workshops so we can talk to you offline about if there's a crew that needs to go to Miami and see for yourself what a diversion facility, what a wellness facility can look like, as Judge Leifman has described. We also need to make sure that we are providing culturally competent care. We have different populations, as you know, in Spokane. So hopefully we can make sure that we are developing those competencies that we need to work with all of our clients. Then we have some cross-cutting ones. Oh, I didn't know if he was speaking. Go ahead.
No, no.
No, you're leaving.
No, I'm just gonna go speak. I'll be back in a minute.
Kate, did you have something? No. Cross-cutting? Okay. So at the bottom, there's some cross-cutting responsibilities for all the subcommittees. Measurable outcomes. Each of the subcommittees needs to be focused on outcomes. What are we trying to achieve? What is success? And it varies. It's going to vary across these subcommittees, but we need to really focus on the measurable outcomes. We also have to focus on the system coordination, that collaboration. We have to be accountable. We, the big we, you, have to be accountable in each of our subcommittee areas and across the intercepts and across the agencies. And then we want to recommend that you all define your timelines. We have a start for you of the action plans that the individual groups yesterday developed, but a bare start. They only had minutes to really start identifying them. But you need, each of the subcommittees need to define those timelines, define who is going to be responsible for what, and what are your deliverables. What are you going to be accomplishing? And we're recommending that you report monthly to the task force on what you have accomplished and what you're working on. And we would be honored to help you in any way possible. So that's the summary recommendations that we have for you. The other piece of materials, and then I'll turn it over to Kate, would be these are the action planning breakout sessions. So for those of you who were attending yesterday, these are your green sheets. And I tried to read them the best I could. I make no promises. So if it's not quite right, you can correct it as you go forward. And then I think to support the subcommittees, what will be important is that list of assets and the more detailed list of gaps and opportunities that, will underpin a lot of your work that we obviously couldn't talk about in any depth, but your subcommittees can dig deeper, all of that work. So Kate, I'm happy to answer any questions and turn it over to you.
Patty, that was perfect. So today we wanted to introduce the subcommittees to you to give you an idea of what each of them would be doing. A first list of potential items that each subcommittee would talk about. Also in your packet is we have been thinking about, from the very beginning of this process, the five have been thinking about subcommittees, and you'll see this one, task force subcommittees and potential membership. Now you will notice the subcommittees on this one don't match what you just saw, and that's because we learned a lot over the last 2 days and figured out a better way to organize the subcommittees. But those of you who said you might be interested in doing something else might be on this list. It's not a commitment, so.
Where is that?
So which one is better? Which one is a better way?
Yeah, don't worry about this one too much. Maybe just to see if your name is on the list. So what we're gonna do is these are subcommittees. But what I just said is these subcommittees don't match anymore, but we're interested in people who are interested in the issues. So in the next month, we would like you to communicate to us about what area you might be interested in if you are. And we're gonna take them next month to really design the committee process, help get the committee some information and background that will help them get organized so that we can launch them at the beginning of December. So your task for us just now is to think about the subcommittees that Patty described and where you might be interested in contribute, because you bring some information or you bring some passion on that issue. So, and you can do that, Alicia, by emailing all of us, leaving us a Post-it note. Alicia, I see you went.
No, I was still on that list of people though is also the people, the names that they all contributed last meeting.
Yes.
For people to serve on subcommittees. So it's not just all of you serving on a subcommittee, but the expertise onto those subcommittees. And so those are, most of the list is actually not names we came up with, but names that you all contributed last meeting.
Thank you.
And so now we're gonna need to take those names into the new proposed subcommittee structure plus additional names to populate the subcommittees between now and December.
Oh, thank you, Alicia. There are people in the community who are here today who would be great on these subcommittees that we will count on you to reach out to them and say we'd like to bring you in. So thank you very much. So we will give you a communication. Yes.
So then the action plan breakout sessions, these concrete action steps proposed, is that from the day and a half, or is that is that solely from the day and a half, or is that best practices that you provided also?
Solely from the day and a half. It was
Yeah.
ideas that came after people were listened for a day and a half. So it's your starter list.
And it was only about a half hour, varied people, so that, you know, they weren't able to go very deep. It's a real starter list, but they're gonna go through, there's gonna be a lot more information that the subcommittees can build on this next couple of weeks.
And there'll be the report from the consultants, the asset assessment that will dive more into what works and best practices that you will also have. Yes.
Sorry, so they talked about the 7% that didn't do well in treatment. Can we discuss what the barriers, can we outline, or will that be outlined? What barriers they saw, why they weren't successful, what were the pitfalls, so then we can maybe pivot?
Thank you very much. That's, I think, coming out of the committees, there are gonna be questions. So give me that one now and we can get back to the consultant to say, okay, we've had this question, what do you know?
Okay.
Yeah, thank you very much for that. Okay, yes.
A time commitment for the subcommittees. What do you foresee that looking like?
What is your experience in other communities?
So the subcommittees can be, you know, I think the task force was thinking at least once a month, the subcommittee's gonna meet, but sometimes it helps if there's little subcommittees to work on a particular area. So I would always consider at least, you know, 3 hours a month, maybe a bit more, 3-4 hours a month for the next 6 months, I think it would be. So that would be my best estimate. But again, there might be some that have to go deeper. And depending upon what you're gonna tackle, there may be additional hours, but I'd say that as a minimum commitment.
And what we'll expect is the subcommittee will come to this task force to start a discussion about the issues that they are working on and test some recommendations that they might have. So they will be your resource. Yes.
So to that end, they're gonna identify priorities, recommended priorities, but also solutions.
Yes.
Okay.
Yes.
Yep. Yes.
Who's facilitating the subcommittees?
We're gonna work on that in the next month. We think that there might be good people, might be chairs for each of the subcommittees. We'll be here for assistance. So that's a task we're gonna try to figure out so you can work efficiently. Yeah.
That's a great question, and I think just transparently, that was something that came up with us over the last couple of days where why we're not starting subcommittees this month is because we really want to make sure the facilitation side is dialed in, and our current contract with our team here does not necessarily facilitate the in-market work that's going to have to take place on a very consistent basis. And so we're looking at where we can add project administration additional support to be able to then be with a consistent person present for facilitation purposes. We also envision likely some form of chair, sub-chair, vice chair from task force membership to be then serving down into the task force subcommittee, so that no matter what, there is a face from this committee and this task force that would serve into each of the subcommittees, and it's not just a completely subgroup of individuals that are not engaged here. We think that tie-in not being just administrative, but being functionally as somebody who's serving makes sense. So can't tell you what that exactly looks like. We've got a lot of stuff on the wall right now, and we're trying to dial in what works and also figure out how we fund all of that part of the work, because there's a lot in there.
I definitely support having a member of the task force as chair, co-chair, because that communication is so important. So that's a great recommendation.
That is an area where if anybody in the task force, we haven't made this request, but if you see an area where a subcommittee, you really feel passionate that you're a true subject matter expert or willing to be the liaison back to the task force and want to commit to supporting one of those, we would love to have your raise your hand and let us know on that front.
I would love to support the subcommittee as well, because I feel most of the subcommittee is people with experience.
Yeah.
And it's been directly impacted by the system, because I feel nobody in here really has, maybe one or two, but that's very valuable for us, and we need that.
Yeah, and we would love some recommendations there too.
Which I think is, I appreciate your sharing that context, because I think the complexity and the scope of the subcommittees is voluminous, to say the least. And trying to get continuity of membership and getting continuity of people to commit their time when they're not being paid and they're working professionals and they have their things going, given the timeline that we're working with to get recommendations. In addition to, when we do have the opportunity and the benefit of having people with lived experience, those people are bringing trauma to those spaces. And you can't just dive right in and expect for them to share their lived experience and share and access their wisdom. Like, there's a process to that. You can't just show up and say, hey, tell me what you know so we can solve this. Like, there's trauma that they have to process through. So I'm just thinking about the time commitment to all this. So I appreciate what you said, that you're thinking very strategically about time commitment and how to facilitate these. Otherwise, I think we might not get the outcome that we're hoping for to be able to bring it back to the task force.
We had dreams of, Kate's really saying we got to start, some of these we really need in December, and we really had that moment over the last 2 days where we said, January is probably the realistic moment to start the subcommittees, just because the amount of pre-planning that will need to go in and development of the groups themselves. But maybe we'll get one of the ones off the board off the ground in December. But again, trying to put a lot of thought into that. They have a tremendous amount of experience of facilitating groups like this between the two consultants. What we don't have right now is we don't have their team in market with the flexibility of that schedule. And so we have to also figure out how to self-perform on some of that within our leadership group. So.
Another question I have around the concrete action steps. Obviously that was built in 30 minutes and there was a day and a half to provide some others. Mm-hmm. One of the benefits of consultants, right? The judge talked to this, is identifying, key areas, concrete steps that they see based on asset review, process mapping, maybe in a short period of time that you've done. But will there be some feedback based on some things that he's mentioned around what he sees in our community that we should really be taking on first and foremost in these committees, just so that there's a differentiation between 30 minutes of, scatter information versus concrete things that a lot of us know, but maybe some of us, based upon our position in the community, what area we work in, we're not as familiar with based on others, if that.
Yeah, what might be most successful if you start there.
Exactly.
So I will work with Patty to try to sort that out on these lists for you. And, I'm thinking back, I heard the judge say, and I think you could do this a couple times, and we'll make sure that we get that recorded for you.
And I think those that were there over the last 2 days also note there's 46 priority points within the matrix that we did discuss, and we narrowed the list down by way of that group of 100 or so people and their insight over those 2 days as to the prioritized list currently is this, but we also have other points that the judge recognized within the full matrix that we discussed. So there's a lot more to this list, but we had to start somewhere. Yeah.
You made me think of one final thing before we go. During the 2 days, there was a couple of groups that came together and said, we think we can solve this now. One was the jail release times. please let us know what those are. Part of our success is going to be showing the community things are changing immediately. So if you are working on some projects, please let the 5 know so we can put that out to the community. Because what I've heard back from you is that, yes, we have been here before, we just didn't get to the next step of change. And we saw change already happening yesterday. So we want to document that to give people further, yes, we can do this. Okay, and with that, I'm gonna turn it back to Sue.
Awesome. All right, and I'm going to lean a little bit on, yeah, perfect, Rachel, thank you. So I love the fact that we are talking data informed and process and systems and solutions. My job and where I come in is really the story behind that data. Because as good as data is, there is so much more power that you have when you can connect that with the true lived experiences. And that then also ensures that the process and at the end game, the outcomes in itself, and what we end up with is right sized to the community. So the first thing I want to show here is the spectrum of engagement. So ultimately, effective engagement really begins at the very beginning. So that's why we wanted to introduce this right at today's meeting. It's purposeful and it's necessary to achieve those results that you're going to see and continue on after you all close out for the day, after the deliverable, we give you the deliverable. But the core of it is really creating that community ownership. And that's where you're going to get transformative solutions. The spectrum goes, I don't know if you all have seen this before, but it's something that we use in engagement a lot. On one end, you have inform, which is really getting information out. And then as you move down, that's really where the collaboration happens and the empowerment of the community happens. How do you get from one end to the other? Who goes where? Which groups are brought into the work? That all is stuff that we are going to be working through at December 4th. The key thing for me, and I emphasize this and Kate knows this, is that community engagement period cannot be extractive. That in the end, for the person who's giving us this information, it can seem predatorial. We're asking them to share with us deep personal experiences, the traumas that they have experienced throughout their lives. And unless you have that information in a real, authentic, and genuine way and creating that space, it's not going to work. It's going to be a plan that lives on the shelf. It's going to be 12 months that we were just in the room and we're talking and having really great conversation, but it's not carried over. So there have been about 6 questions that over my career, my time with MIG, that we've been able to refine to help groups like this work through what those questions are. And hopefully at the end of this, especially at the December 4th meeting, we're able to identify who those people with lived experiences are that will be part of these subcommittees. So this first question here is really about ownership and implementation. So who needs to be at the table at the end for this to work? We need to talk to them at the very beginning. And it's about education. It's about informing them. It's also about buy-in. The second question here is about influence. So often we recognize formal leaders. It's easy to recognize. There's titles, right? There are positions, there are hierarchies in place. But for a lot of communities and cultures, and I'm not just saying racial and ethnic cultures, but also socioeconomic cultures, there's informal leaders. And most of the time, we don't tap into them. So this whole question is about identifying who those informal leaders are. So for example, in my community, it's the auntie, right, who isn't my mom, and I'm going to listen to. And she's going to tell me how it is. It's the bodega owner who gives jobs to the youth, who's involved with the school system. And ultimately with this, and what we're going to try to do is create space for project and process advocates. So this third question here is about widening that network of influence and again, creating those process and project advocates through the process in itself. So there's a strong emphasis in the very beginning. If we ask ourselves this question and we come up with an answer of yes, we want to make sure that they understand the project itself, process, and outcomes during the initial phases. And then we want to give them the opportunity to engage with us and talk to us in whatever space it is that they feel comfortable. So it might not be you, but it might be your colleagues. It might be the staff person who's at the table who's picking up the phone. Those folks need to be a voice at the table as well. So next set of questions is really, the first one is about representation of all perspectives and experiences. So I'm going to borrow something from the judge. Can I ask you all a personal question? How many of you have experienced mental illness within your immediate family or yourself? Raise your hand. Exactly. So while there is a lot of us, it doesn't represent the entire spectrum of experiences here. The last two questions is really about relationship building. And in the case of question number 5, it's rebuilding that relationship with a system that's often untrusted. And finally, the last question here is dealing with the other end of the spectrum. Who has been at the table, who wants to be at the table, who can contribute in a way that informs our process and moves us forward. So ultimately, all of this is meant to empower people. We want this to continue forward and not just be something that lives within this room. For it to work, it has to live outside of the room. So through this entire process, what we're doing is we're really building ownership through change, through building relationships within this room and outside of it. So the values that we share within this room, so come to December 4th being ready to talk to each other and to really work. I said at the very beginning, this question here is going to be the basis for what we determine to be the shared values are for this group, what you determine to be the shared values for this group. And ultimately, all of what comes out of that is going to be statements, guiding principles that we test the recommendations and the solutions against. And while we won't agree on everything, the ultimate goal here again is building consensus. So December 4th, it's going to be 2 hours of really intense conversation. There are 2 questions that are on your agenda that I would like you to think about. And if you already know, what the engagement efforts have been, or who should, or ideas of groups or persons that should be at the table, write them down. You have Post-it notes, we'll collect them. But really at the next meeting, we're gonna wanna define further what we can build upon and then who those folks are going to be.
Do you want to tell them the 2 questions?
Oh, yeah. So, so what are the recent community engagement results we should consult? I know that there's been a lot of work done. I know that you all have systems where you track metrics. And then second, what does engagement need to look and feel like for this process to be successful? I know feelings can be pretty hard to nail down, but it's so important for something so personal.
Well, they're on your agenda at 10:30.
Any questions?
All right, thank you. So December 4th, it's gonna be a really big day. We're gonna do a couple of things at that meeting. We're going to develop a community engagement strategy as to who do we need to talk to? And we're doing that to inform people, but also to build support over time. So as Sue said, we want to start with the people in this community engagement that we really want to have in May. informed and supported and ready to move forward with us. So there's one. Two, we're going to work on developing, as Sue said, our values and guiding principles so that when we get to May and have recommendations, we know what those recommendations have to achieve. So that'll be the second thing that we're gonna do. And then third, we're gonna launch the task force subcommittee side. You're the task force. The subcommittee process, we'll have figured that out and how that goes and have really good packets for you and information so that you can really work efficiently and come up with recommendations. So it's gonna be 1, 2, 3 there. And what I want you to think about before we get to December to take away, your only homework for today is we really want to know what does success look like when we get done? What is it gonna feel like? What's gonna be different? We really wanna describe that pretty clearly and then work toward that. And with that, I think I'm gonna turn it back to our 5 leadership to close out the meeting, unless there are any further questions, ideas. Yes? Doctor.
Just a quick reminder, I guess. There were some slides that were used on the first day that were very useful. Are we gonna get those?
From the assessment?
Yeah,
Yes.
No, I
From
think-
Tuesday or Wednesday, Celeste?
I think it was Tuesday.
Yeah, yes, we are gonna get, yes.
I assume you're talking about the assets that were listed
Before the
and the
assets-
gaps in the materials?
So before the
There's
assets were a number of
presentations.
introductory slides with our.
Oh, yeah, you'll get the slides too.
Okay, good.
Yeah, sorry.
All of them you will get. and-
You'll get all of it.
Thank you.
Anything else? I wanna know, did this setup work for you? We should try something else this time.
Too many ones.
Okay, back to you. Emily, you think you're gonna close us out? You open this up or are you gonna make Lance do it?
Sure. Well, we know we've taken a lot of your time over the last several days and today, and but again, thank you. Obviously, this is important work, and we appreciate your commitment to continuing to show up. We are in this. It may not be this room specifically, but we are here for our future task force meeting. So keep that in mind. We might shake up the room a little bit as far as where tables are, but in the meantime, and I probably should have put this on the agenda, is info@safeandhealthyspokane.org. That is an email address that all of us get. So instead of having to remember all 5 of our email addresses or our facilitator team, if you have questions, ideas, if you're anything like me at 3 a.m. when the dogs wake you up and inspiration hits, you can email that address and we will compile that. We meet weekly with our consultant team.
Say it again.
What's that? info@safeandhealthyspokane.org.
Is
And
it-
it's
We'll send
spelled
that
out.
to you in the
It's spelled out.
follow-up.
That's also safeandhealthyspokane.org is our website too, and that's where we're also updating our public facing information. So if there are items on the website that you think are opportunities, you can also send that an email to us there, whether it be links, we continue to gather that coverage. You'll see, especially as we get into the community engagement phase, a lot of that will live on the website. You do have access as well, Rachel, and we'll probably send it in our follow-up. There is a shared Google Drive that has been created with a lot of the materials that we've been sharing with you. The presentations will be added there. So you'll see that link again in the wrap-up email you get from Rachel. Is there anything else that we?
I think the last, I would just encourage you as you look to refine subcommittee groups. Obviously, you've had that chance to submit other names and bring other people to the work that are subject matter experts that would behoove us to have working on these gaps. Certainly don't stop thinking about that, because now is the entire moment that we can find what those groups are going to look like to some extent. Who engages in those? We want the best people from our community engaged in that process with the most information possible. And so just again, be mindful of that as we head towards launching the subcommittees. This is a great time to continue to build that list of stakeholders that we can engage. I think when we look at the 100 or so people in the room over the last 2 days, there's a lot of expertise there, and that was why the conversation was so great. We look to fill those committees, the same thing. A lot of those individuals will complete subcommittee work, but that is not the fully conclusive list of people from our community that could prove valuable to the process.
I think that's actually really important to hit. We recognize that there are a lot more people that need to be touched and need to be included in this process. And so we would ask you to come along with us and help us identify who we need to reach out to, who is not being included yet, so that we can continue to grow. That is part of this effort in particular, is to say, let's be as inclusive as we can be. And we fully admit that we definitely are not the know-all experts.
In the spirit of the
this
judges
area.
telling a story, we had a group yesterday that was identified that felt like they weren't invited. In fact, we were able to show they were very much invited, but did not make it to an email address in an inbox that got a response back the way that the other individual who showed up to the assessment felt they would have responded. And so again, communication, one of those pieces, we solved that one problem. I'm sure there's others of those that are out there. So again, it's the beginning of the journey, not the end of it. And so just help us out on that.
The other thing that I would just say is to reinforce both what's just been said and what Lance was saying earlier. I think part of what we're taking out of this conversation and where we're at this point is we need to get a lot clearer about what we expect and what we hope that the subcommittees will be able to do. We'll do that through both kind of a chartering process, but also clarity about what kind of support the subcommittees are going to need in order to be able to do that. Frankly, as we've said, that is where a lot of this work is going to happen. You all are really critical in terms of moving forward a set of recommendations, but those subcommittees are going to be the ones who are going to be wrestling through a bunch of that. So we're going to work on that. We have a meeting with what we call the larger planning committee, which includes elected and staff representatives from the city, the county, and Spokane Valley as well tomorrow. And we're going to enlist them in helping us to do that. As the judge had mentioned day before yesterday, I think this is the first time that the Lifeman Group has engaged in a community where the kind of precipitating organizations are private sector. This usually gets comes up from public sector. Great partnership, which is awesome, but it also means that we're kind of building this plane as we're flying. But we have some really great thoughts and perspective about how we can really get focused. But I would just encourage you to keep raising the questions about, all right, how is this actually going to get accomplished in a way that brings the right perspectives to the table, but also allows us to get to some real and tangible recommendations in the short period of time that we have. So stay engaged with us on that. And we'll have, I think, more clarity about that in the next few weeks than we have at this moment.
Are there any questions for us before we conclude? Yes.
What would be the best way that you want us to share potential members for the subcommittee? So we'll do it the same way. And could you email that, because some people are not here, so we all do it exactly the same way
Yes.
for you?
So it will be included in the follow-up email that comes from Rachel, but for now, that email address is sort of, all of us have access to it. So that's how you make sure someone will see it. info@safeandhealthspokane.org. Yes.
Just a suggestion, I don't know if there could be a document similar to what you have where when you review who's already signed up, it kind of helps from the standpoint of, if, say,
Who's
for us at
concerned,
Providence, if we have strong other representation, certain subcommittees and not so much in others. So I don't know if there'd be like a shared document we could just sign into, or we could visualize that. I think that would help.
That's a great idea. Yeah. Thank you again.
Please, if you're hungry, take a box of food.
Yeah,
We don't have a.
And remember that.